Hey guys, welcome to my channel. My name's Abby and a couple of months ago I underwent a spinal fusion surgery in order to correct a curvature of my spine known as scoliosis. I just wanted to create this video to help anyone who is going through scoliosis or is potentially thinking about having spinal surgery, anything like that, just to share my experience with you so you get a bit more information on it. I just wanted to put a quick disclaimer out there that everyone's journey is different and this is just my experience. Just because I've experienced one thing doesn't mean you're going to experience it in exactly the same way. If you don't know what scoliosis is a sideways curvature of the spine that usually develops during puberty as the spine grows outwards from the midline of your body. It's actually much more common than people think, as many people have a slight curve in their spine. However, only 10% of people with scoliosis actually need spinal fusion surgery. This is because most people can be treated with a brace or actually just left and doesn't cause them any problems into the future. Mine unfortunately did have to be solved with spinal fusion surgery, which I do not regret in any way, shape or form. It gives me the best possible outlook for the rest of my future. We actually began noticing that I had a proper curvature of my spine at the start of 2020 when I was 15, which is older than the usual child who gets diagnosed with scoliosis. However, at this point we noticed that my hips were not aligned anymore, one of my ribs stuck out, my right shoulder blade stuck out much further than my left. So we went to get it looked at by a consultant and we did x-rays and MRIs. This just gives the consultant or surgeon an overview of how badly your scoliosis is, how far your degree is, and it also gives them an idea of your spinal cord to see if your spinal cord is being affected. After we got my x-rays and MRIs back, it was confirmed that I had scoliosis. I actually had an S-shaped scoliosis with a right thoracic curve and a left lumbar curve, which is the top and bottom of my spine. My thoracic, which is the top, I had a 54.9 degree curve, and the bottom I had a 43.1 degree curve, which meant that my scoliosis was quite severe at this point, not compared to some people who will have 70-80 degree curves, but mine was over the 50 degree boundary, which is what a lot of people say is a common point for you to be considered for surgery. However, my x-ray and MRI did actually reveal that I also had a slipped disc at the base of my spine known as lytic spondylolisthesis. I also had microfractures in my lower vertebrae, which meant that my treatment was a bit more complicated than the usual spinal fusion, as they had to consider what the best option would be regarding my lower spine. Therefore, I was sent to a different consultant who's called Mr. Malloy. He's fantastic. He decided after doing some more bending x-rays and a CT scan that my bottom curve was actually derived from my top curve. He thought if we could get the top one straight, the bottom one would actually come in itself, which is what we decided to go with. I got the top part of my spine fused. With having the smallest part fused, it meant that he could leave the bottom alone. Minimal pressure was placed on the disc, which meant there was less chance of it slipping. Overall, that was the best treatment for me. 2 weeks before I went into surgery, I went to a pre-op appointment where they do your height, your weight, they take your blood pressure. They took a lot of blood. It was the most blood that I've ever had taken. A lot more compared to a blood test. However, they did a complete blood review to make sure that you are fit and healthy. They also did ECGs on the heart. The nurse who did it was lovely. They just walk through the surgery, what to expect from the surgery, and you get a last chance to ask any more questions. At this appointment, I was also given some booklets to help with scoliosis, just to give a bit more information about surgery day and all that kind of stuff. Something they did actually mention to us, which I luckily didn't experience, was that if you are a girl, periods can be messed up a bit. Then as we were leaving, they also gave us some antiseptic cloths, which you have to wash your body for the 5 days surrounding your operation. And the same thing occurred with the nasal ointment that they gave you. It's really just to prevent any bacteria, anything getting in, so you are completely clean for the operation. I went into hospital on a Friday the 11th of December, because my operation was on the Saturday and they want to get you in there early. When we first went in, we got some new x-rays done. The new x-rays show that my curvature did get worse. I ended up having a 58-degree thoracic curve and a 51-degree lumbar curve. So both had grown quite significantly over the course of the few months. They ran through kind of the operation again. There's lots of confirmation leading up to the operation to make sure you're 100% into it. Everyone in the hospital just wants to make sure that you are completely comfortable and that you understand what is happening to you during the surgery. You can't eat for 8 hours prior to operation, and you can't drink at least 2 hours prior to operation. So the last meal that I ate was Friday evening, and then they woke me up early on Saturday to get me my last fluids. I didn't actually get started getting prepped for surgery until about 12:30, 1 o'clock on Saturday. When they start getting you prepped, they put numbing cream on your hands, which is where tubes will go in for your anaesthetic to keep you asleep during the operation. You're also given these stockings, which I still have mine. They're just compression socks to stop any blood clots occurring because you are staying in bed for a lot of the time. I was also given the gown and paper pants. They're just a thin kind of stretchy material that they can cut off easily when you're in the anaesthetist room or anything like that. It's just for modesty. If you have longer hair like myself, I would suggest that you put it in braids because it keeps it out of the surgeon's way. And then I was wheeled down to the anaesthetist room on the bed. My mum was with me. The anaesthetist was lovely. He was very nice. And he wants to make you feel comfortable. They don't put you to sleep straight away. They just kind of talk to you. My mum was actually asked to leave the room just before I went to sleep, but they just asked you to count back down from 10. Then you're put underneath. You don't come back up until your surgery is finished. You feel absolutely nothing. You don't wake up. That's the anaesthetist's job. So they are monitoring you carefully throughout the operation. Along with actually the spinal fusion occurring, they also put in a catheter, which is to help you urinate. It's because you won't be able to get out of bed straight away and use the toilet or anything like that. The only thing you'll notice is the cable that goes down and it's hooked over the side of your bed. And they also use it to monitor the colour of your urine and stuff like that, just to make sure you're healthy. Regarding the actual spinal fusion, what happens is they open up your back. Between each vertebrae they want to fuse, they'll carefully insert some screws, and then they put titanium rods in the middle, and that straightens up your spine. And then they'll put some new bone marrow on, which will help consolidate the spine, and straightened up my spine considerably. The top curve went from the 58 down to only 28 degrees, which was amazing. I was actually lucky enough that I got to use a robot. It just helps the surgeons kind of guide the screws in. It's less invasive, so there's less pain caused. It also means that the surgery is much quicker and a lot more accurate. Overall, my surgery actually took 3.5 hours. So I woke up in the anaesthetist room again. It's very, very vague because you're still kind of dozy and asleep. But I was wheeled to the children's high dependency unit where I stayed overnight, and my mum was waiting there for me. When I woke up, I had the face mask on, which is providing oxygen for you. I also had lots of pain relief and stuff going to my hands. So overall, I had 4 different inserts, here, 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 and here. And you're given a drip, which releases pain relief when you press the button. The button's only for you to press, nurses, doctors, your parents, no one else is to touch it. It's just for you to touch, and you'll get pain relief on demand. There is a limit just for safety reasons. I actually have a very high pain threshold, which meant that I didn't need a lot of the pain relief, but the overall pain when I came out of surgery was an overall numb. The only time that I actually could feel my back in a pain sort of way was when they move you. You get moved every 4 hours. Now, this is because when you're lying, you can get bed sores, so you're transferred from your back and your sides. And I found it a lot more comfortable on my side than I did on my back, but that was just personal preference. Along with being turned every 4 hours, you also get kind of checkups every 2 hours in high dependency unit, which is where they do your blood pressure, your heart rate, your temperature, just to make sure you're overall kind of healthy. Unfortunately, I was actually sick that night that we were in high dependency unit. I had a small amount of water to drink that evening and I threw it up at about 2 a.m. in the morning. So I was actually given my bed bath then compared to in the morning. When I woke up on the Sunday morning, I felt so much better. I just felt more like myself. I had a small amount of fruit to eat. I really didn't have an appetite, but at that point it'd been about 38 hours since I'd eaten anything. They still have you on a liquid drip, so you were being hydrated, but you weren't being fed. And then just before I left high dependency unit, I was taken off my morphine drip, which is that button that I explained. You're still given that pain med, however, they start to give it to you in tablets. The physiotherapist actually came to see us and they kind of give you bed exercises to do. So I was given things like squeeze into the bed and then release. Try and wiggle your toes, just kind of basic exercises, nothing hard. And then at about 12ish, I actually sat up for the first time. You get rolled onto your side. You then place one hand onto the bed and the other across your chest, and then you push up with that wrist, and it tilts you upwards off the bed. Highly recommend that you get some flat shoes. They're the easiest to walk in. I don't recommend having any slippers that are easy to come off, so really get some secure shoes, whether that's slippers with a back on them, or I had some Vans that I used. When I did actually sit up, I had to wear this, which is just a kind of corset thing that goes around the body. It's just a Velcro, it Velcros up, got hard bits in the back just to support you really. Your center of balance is going to be off. Your body has created a center of balance with your curve. The curve's now gone, so you feel like you're not straight. So it's just for some extra support while I awaited having a brace made for me, which would do the same job. I managed to stand up, however I got very, very dizzy when I stood up. We did a few marching, but I was too dizzy to actually try and take proper steps. So I got back into bed, lied down, and we tried again that evening, which I did manage to stand up, and I walked around my room a bit, and then I sat in a chair. When I was lying down, it almost felt like I was on uneven ground, if that makes sense. Not a painful uneven ground, just uneven. And like I said about the midline of your body, it felt like I was lying not straight, even though to everyone else I was straight. So the sitting up was so much more comfortable for me. However, I only sat there for about 20 minutes before I got back into bed. At this point, I still wasn't eating a lot. I really wasn't eating. My appetite had just completely gone. The next morning, so Monday morning, I actually got casted for my brace. I just had to stand up and they molded it to me. I know a lot of people have to have back braces before they go into surgery as an option. I was fortunate that I actually never had to have that, so this was my first time ever getting casted for a brace. The team were checking me throughout to make sure I was okay. Everything was fine. I wasn't feeling lightheaded or anything like that. And I was actually given the brace that evening. I'm still currently having to wear the brace 2 months on. I'm going to have to be for about kind of 5 to 6 months post-op. It just helps my bottom curve come in while supporting my back. Front is like this and the back is a hard plastic material, which you get to choose a design. They give you a whole booklet of design. I have a leopard print on mine. You really get free reign of what you want on it. When I came back to the room, I actually had another bed bath. I actually got my catheters taken out because I could now walk to the bathroom. So that was taken out, and you just cough and it just kind of boop, comes out. It's the weird feeling it coming out, but then once it's out, feels so much better. So I was put back into my own clothes actually. I was no longer in a gown. However, I highly recommend some front buttoning up pajamas because lifting your arms above your head is not something that you want to do. It doesn't feel right, and they can put them on easily over you while you're still in bed. I still had to wear the compression socks and the compressing kind of machine thing to prevent any blood clots. But I got very hot in hospital. I had a little fan next to me, so I opted for short length pajamas, but you can go for long, anything. Just I would recommend it tying up the front. After I've kind of got changed and everything, the physio came back to see me again, and I went to their mini kind of gym area where we learned to do steps, because before you get discharged you have to do steps on your own. So I managed to do that. I managed a few of them on my own, holding onto the handrail, which was good. However, on the way back I was sick again. But yeah, just keep that in mind. I got sick. I'm not sure if everyone will get sick, but I'm not someone who gets sick at home usually. I can't remember the last time I was sick before hospital. At this point, I was actually discharged from physio because I was able to walk up and down the stairs by myself, walk around, sit up by myself without any support. I still had to be turned every 4 hours. However, I still couldn't open my bowels, which they do like you to do before you go home. However, my surgeon was happy. I got some new x-rays done. He was happy with how it went. He was happy to discharge me. The physios were happy to discharge me, all that kind of stuff. So they decided that I could open my bowels at home. I actually did have to get a shower, so we used a shower chair, and if it's possible I would recommend you get one for home because standing up on the slippery surface is not ideal. However, when I say I hated the shower, I absolutely hated the shower. I just felt I was set up without the corset or brace on, so that was weird. I was also not cold as such, but I was no longer in clothes, so I was just sat there shivering almost. It wasn't a pleasant experience. However, we managed it. I then got changed and I was discharged. So I was back home, and showering back home, it was still weird because I still couldn't manage it completely by myself. My mum still had to help. It still took me quite a few times before the showering felt okay. You're not supposed to get the covering that's very wet at all. Kind of showering, washing your hair, I'd just be very, very cautious. I decided not to wash my hair originally because the thought of having to kind of move my hair around to stop my back from getting too wet, I just wasn't feeling it. So I went without washing my hair for a bit. Pain medication, they sent me home with tablets. So when I left the hospital, I was on 1 dose of kind of high, stronger painkillers and then just paracetamol. Because I'm asthmatic, they kind of keep me off ibuprofen as much as possible. And then by that Saturday, Sunday kind of time, the weekend, I was off all my pain meds, but everyone will come off the pain meds at different times, depending on how people are recovering. Like I said, I have a very high pain threshold, so it wasn't causing me too many issues regarding that. And the hardest bit for me when I did come off the pain meds was the sleeping. I actually stayed on pain meds sleeping for longer than I did during the day. When you're lying on your side in hospital, they put cushions behind you just to support your back so you don't end up twisting because you're not allowed to twist. I have one of these things, which was easier to put than a pillow behind me, and it meant that I could do it myself a lot easier. So if you are able to get one of them, it's the thing that helped me to sleep a lot better after the operation. My mum did sleep in my room a couple of nights just to help me because there was times where I still needed her help. Every day I really would recommend just walking, even if I would just go to the supermarket with my dad or something, just so I was walking around inside the supermarket, because increasing that mobility is what's going to help you to recover quicker and gain more independence. But despite this independence growing, I still was struggling to eat, and it came around to the next week and it was eating in small dosages more often because I couldn't manage an entire meal. I had some soup. Soup was what I had most days just because it was easy and I didn't have to have a whole can or anything like that. I was lucky enough that I had most of my appetite back by Christmas, but it still wasn't completely. Because of the slow eating, it took me about a week after I came out of hospital to go for a poo or open your bowels, as they say. However, you are actually given stuff that liquidizes your poo just to help it all come out. Tasted awful. I would recommend putting it with squash or apple juice, orange juice, anything like that. It helps just to make everything a bit more liquidy inside you to help everything go out. About 2 weeks after the operation, you're likely to get a wound checkup. For me, it was about 16 days after because of Christmas, how it all fell. It's just with your local nurse. They take off the dressing, make sure everything is closed up. All of my stitches were dissolved, so there was nothing that had to be taken out. The scar was bigger than I expected just because although only a small amount of your back's getting fused, they have to open it up a lot wider to actually able to screw everything and get it all fused together. Before I went into the surgery, I was about 5'3". I've grown just over an inch since, so my scar isn't too long, especially with only having the 7 vertebrae fused. And the scar was the bit that I was most scared about going in. I didn't really care what they were doing to my back. It was just the scar that I was like, no, I really don't want it. And if anyone had told me that it really wasn't a problem, I wouldn't have believed them. I was like, no, this is the worst bit. It's not the hospital stay. It's nothing like that. It's the scar. Trust me when I say that when it's on you, all of that fear or worry about it being a big scar on your back disappears. And then just to help kind of treat the scar, we use bio oil 3 times a day with massages. So a circular massage, a back and forth, and then down the length of the spine. If you prone to having eczema or you know that you're allergic to vitamin E, I wouldn't suggest doing this all the time, because about a month after we started using it, maybe 3 weeks after, my back was becoming drier and drier. So we went to pharmacist and they said how it does contain vitamin E and that is known to dry out skin sometimes. So I think just be aware of that. We're also using Aveeno cream to keep it moist and kind of using the bio oil just the 1 time a day. Where the scar is, it's still a weird feeling. You can still feel everything, but it's almost like it's not fully there. It's almost patchy. That's because all of the nerves have been cut. They're all coming back together. So there's still sections that feel like that now, and I'm 2 months post-op. It's not a big issue. Please don't be too scared about the scar. And then about 6 weeks post-op, you'll talk with your surgeon again, and then he or she will walk you through exactly how your recovery is going and your plans from there. My spine seems to be straightening up nicely. The bottom curve is coming in how he would expect it to. I still can't play any sport, and that's not going to be anywhere in the near future. As long as I'm wearing the brace, it's still completely off. Before, I was a very, very sporty child, and not doing sport again, I was more scared about than the operation. But again, having kind of 6 months, 8 months, even a year off sport is much better than the long-term effects of not having the operation personally, which is the main kind of reasons that we did it. There is still the limit, and there still will be the limit of only being able to lift 2 kilograms, 1 kilogram in each hand as the maximum to prevent any kind of strain on the back. The brace prevents me from doing any form of like actual twisting of the top half of my back, any bending, anything like that. Really just keep your back as straight as possible to help it all consolidate and heal properly. But apart from that, everything in my life is back to normal. I'm fully independent. I don't feel restricted in any way, obviously minus the sport and the lifting 2 kilogram kind of thing. That happened quite quickly. Being young and kind of being a child, everything bounces back quickly. I was quite a fit and healthy child as well, so that really did help. Make sure you are drinking enough, eating healthily, all that kind of stuff before, after your operation, just to help with your body's recovery, and your body will bounce back quicker than you thought. It's an amazing machine that will recover very, very quickly. So that is my kind of story. That's where I'm at the moment. I'm 2 months post-op. I'm feeling great. I have no regrets about the surgery whatsoever. All my family and friends have been so supportive, and every single person that was involved at the hospital, consulting, nurses, absolutely everyone has been amazing. I really could not ask for much more. They treat you so well, and they really do have your best interests at heart. Even if they're trying to get you up and you don't want to get up or anything like that, they really are doing it for your best interests. I really, really hope that this video has helped anyone who's thinking about going through scoliosis surgery, wanted some more information, anything like that. Thank you for watching, and if you have any more questions, please pop them down below and I'll be sure to answer them.